Welcome to Regional Trans Podcast Series 2. This podcast is recorded on the land of the Jar Jar Wurrung, and I pay my deepest respects to elders past, present and emerging. Sovereignty was never ceded, and I acknowledge that the First Nations sister girls, brother boys, trans and gender diverse people have always been part of these lands, stories and communities. My name is Brodie Clayton, and today we are joining you from Thorn Harbour Country in Bendigo, where trans and gender diverse people from across regional Victoria have come together for a day of connection, storytelling and shared learning. In this series, every episode is shaped by the participants themselves, their insights, questions and their lived experience. Our aim is to amplify regional voices, celebrate our resilience and build a deeper understanding of what it means to be trans in rural and regional communities. We will be diving into personal stories, community wisdom, moments of vulnerability and moments of joy. We invite you to listen with curiosity, care, and an interest in growing a deeper awareness of trans lived experience, recognising that people's experiences are diverse, complex, and valid. Regional Trans Podcast Series 2 has been supported through Victoria's Pride, a partnership between Victorian Government and Midsummer. Today, Episode 6, we are looking at Beyond Gender Affirming Care, looking at healthcare for trans people outside of gender affirming care, whether that's mental health, sexual health, disability, aged care, or general well-being. So when people talk about trans healthcare, the focus is usually solely on gender affirming care, but we do have the same health needs as everyone else, plus some unique ones. So what health needs outside of transition have been important in your life, and why do you think these areas are often overlooked or under-discussed when we talk about well-being? To the room.
Who wants to kick us off? Have you had any experiences where you've sought care? And
I think I'll start off.
Yeah.
In my early trans man, late non-binary phase, I had to seek care that mainly pertained to being a female, and that involved a procedure. Now, up into, my GP that I was seeing at the time was lovely, and she was very careful with, being around, and she said, I need to refer you to the hospital, and I can't guarantee what it's going to be like there. And I said, okay, no worries. I know about the hospital. I know medical stuff, and I'm generally pretty thick-skinned when it comes to medical procedures and understanding that things can be a bit dysphoric. And when I had this procedure at the hospital, my first experience was one of the intake nurses, or an anaesthetist or something of the sort. I can't quite remember what she was, but after we had all of our intake conversations, she then stopped and said, now I see you've put down non-binary and you identify with the pronouns they, them. And I said, yep. And she said, that is absolutely wonderful. I will do my best in everything that I do as a nurse for you today to make sure that every single person respects that and, come to me and tell me if someone doesn't respect that. And I think, this conversation that we'll be having today is a very, there will be a lot of negatives to it. But I think it's little movements like that, little people like that who make sure that you feel seen and heard, that I think is super important. To make sure that in every healthcare aspect, we feel like we are seen as people and we're not seen as, freaks or creatures or question marks sitting in a hospital bed. And I think that, was a great experience for me. And I've never, sort of lived that down. I've always thought that's, a wonderful, warm thing that has left me feeling good.
Beautiful
Fantastic.
allyship. Yeah, absolutely.
Love that.
Unfortunately for me, I had an experience that wasn't so affirming.
Yeah.
So my regular GP was unavailable at this time. And so I saw somebody else that was available at the clinic, and assumed that, because I've been going to this clinic, that and it's been really affirming up until this particular time, that it would be all fine. and I was going in there just for a script that was just general health needs, and it was a script that I'd had previously. But when I went in to see this person, they looked at the computer and they looked at the script, and they, I said, just need another one of these scripts. And they looked me up and down, and then they started talking about my sexual health and asking me questions about my trans experience, completely unrelated to the script that I was going in there for. And so I found myself in this GP's room having this conversation about trans experiences, providing a little bit of education. The person was quite challenged also, and so it wasn't just a curiosity where they were being empowered. It was actually, let's have a debate about trans experiences and trans existence, and what you should or shouldn't be doing. And when it came to the sexual health, there was this whole conversation around being a trans lesbian and whether that was appropriate or not. And so, yeah, there was definitely a swing away from what I was there for to, okay, tell me all about your trans experience. And I just, I found that was quite intrusive and left there feeling very uncomfortable. And as you could imagine, I didn't go back to that clinic. I changed clinics to an amazing GP who I'm very happy with.
I imagine that's a pretty big barrier to care for a lot of trans people. Even myself, in accessing services, it is difficult walking cold in with someone you've never met before and sort of having to be braced to educate around your own healthcare and advocate for yourself quite strongly to a medical professional and really be that point of knowledge. I accessed a sexual health service a long time ago, and I walked in there for advice around my sexual health, and the nurse said to me, "I don't really understand this trans stuff. Could you explain that to me?"
But I think that falls back onto them, though.
Yes.
Like that falls back onto them as professionals to learn that. Yeah. And not put their clients or the patient in a very awkward position of, having to protect themselves, advocate themselves, and I suppose drag that conversation back to why you went there in the first place. So
I'm going to jump in because as the doctor here, I'm going to make a couple of things and I'm going to state a couple of things. First up is an apology in general for the profession that I am in. For all the trans and queer people out there, I'm very sorry. We have done very bad things to you, and for various reasons, which we'll get to. And it's part of the reason why I basically only want to take queer folks on at this point. I am sick of cis people, huh? So, and one of the patients, I can give you so many horror stories, I'm sure, but one of the patients that came in was a kid who was 12, 13. And she was this gorgeous little girl in her school uniform with her mother who said, "We had to change doctors because my last doctor said I'm against his religion, so he can't treat me." And I was like, so many swear words came out of me at this point. And the mother said, "But that's all right." I said, "No, it's not. You really need to complain to the board about that doctor, because that is so disrespectful, so just, it's not even, that doesn't even make sense. And of course I will take you on. Goodness gracious." So, that's sort of not even an uncommon experience, which obviously makes me very upset. And I think, I'm one person. If I can make my stand and do it, I will make myself happier. I'll make other people happier. I may not be able to fix everybody else's clinic right now. I'll start with my own. But there are 10 of us who work there. I can't speak for all of them. Some of them are dinosaurs birthed at the crack of dawn, and they just will never get it. One of them said to me, "Well, if they're not a he or a she, do I say it?" And I'm like, if you want to get slapped, ask. But most people don't go by it, but all right. That's the sort of understanding. It's just, there's never been an exposure. And for a lot of us through medical school, no mention, right? Trans stuff, not a thing. So that's why a lot of doctors, a lot of health professionals have no idea. And then you turn up and they go, I realize I have the gaping hole in my knowledge. And then the first person they ask for information is the poor person in front of them.
The one that needs help.
Correct, which is quite the inappropriate time. Like, this is not the time. It's like anything. It's like asking you to educate me on your Aboriginality, on your cultural background, you know? Like,
Right.
that's not the time for it, my dude. Go and, like, yeah. But instead, then they've got curiosity better of them instead of clinical acumen. And they've sort of went for the human thing rather than leaving it for the appropriate time. So I think that's what happens in a lot of cases, is that people are suddenly confronted with something they completely had never thought about before as such. So then that's where that comes from. There's too much binary education in medical.
And I think that's where it's really important for the trans umbrella peoples to work in healthcare fields. As a person who currently works in a healthcare field, I get the job to be able to educate my co-workers and to talk to my doctors that I work with and talk to the nurses that I work with and teach them how to be better people and how to be better allies and better providers, because I know it's not my job specifically, but I feel like because I'm not there to get treated, I'm there to work. I'm there to make sure that the patients that I'm seeing in my work and the patients that my co-workers are seeing in their work need to be cared for and should be cared for in a holistic and wholesome way.
Beautiful.
Yes, Tom.
So I want to go back to your point about the gaps in education. This is something that I have been through myself recently a lot in the last couple of years. This is a major pet hate of mine. And I've addressed my concerns to the board a few times. And this is that when we have these professionals, and in my experience, these are psychiatrists that are doing this. Yeah, okay. And they have no knowledge of diversity, like as in the LGBTQI community. They have no knowledge of neurodiversity. They're doing these quick assessments and they're filling the blanks in by profiling. So they're taking, if you look at the report that came out from the Australian Human Rights Commission on what the LGBTQI suffers, 66% more likely to suffer for intimate domestic or family violence, and the mental health challenges that we have and the AOD issues, and, there's a lot there. So they fill these blanks in with these, and there's no consultation with this.
See, that's just poor medicine, isn't it?
It's horrible. So we're looking at ultimately just straight up fabrication of information to try and fill in these blanks and these voids, which then enter into the public record and into people's medical files, which then we have to fight to suppress or correct. But we were there in the first place to simply get help.
The process you're describing seems very suboptimal. This shouldn't happen. This shouldn't happen. It seems very suboptimal, old school, whatever you want to call it. But we shouldn't do this. Clearly, some people are still doing it. And I think those should not be the norm at all.
Well, I think they shouldn't be allowed to practice full stop. Like, if they're not taking the time to sit down and get the information from the patient to make an informed decision about the well-being of the patient.
Yes.
Right? Why are they filling these things in just willy-nilly and just, profiling people, really? Because that's... And this isn't exclusive to my rights under the LGBTQI. This affects everyone.
Well, this is what I mean. That shouldn't happen. So that's just poor medicine. Whoever's doing that is, if you asked 10 doctors, is that the right thing to do? We are going to say no.
Yeah, you're all going to say no.
That. We would not do that. And as a GP, I would not conscientiously be fabricating things consciously either. I don't know who they are that you're seeing, some psychiatrists, etc. Sure, I don't know. They might be doing things like that across the board, or it might be coming from a place of extreme ignorance about your situation, and therefore they kind of confabulate. They fill in the blanks. And that is also not on. I'm not condoning it. It's just a bad thing.
No, I agree with that. And obviously someone like myself who is strong enough and who is resilient enough to stand against this, who knows how to use the system to correct these and, to get this information to stop any further damage being done. But I know the extraordinary resilience and knowledge that takes to do that. And not everyone can do that.
I think what it highlights, though, is that there is, and we talked about this a little bit in the last episode, where there's a lack of information relating to trans health. And so when a trans person comes in and somebody has to provide some kind of outcome for that person, they have to base it on what knowledge they already have. And as we know, there's not much education freely available. And statistics and all of that health information for trans folks. And so, coming on to statistics, which leading into stigmatization and assumptions, all of that sort of thing. But as you say, getting to know the person, treating the person with what information they get. I guess for what we're talking about here is a part of the issue that we have is when we go in because we have a particular need. So we're not going in because we want an assessment done on our trans health mental health or whatever it is. We go in because, we just need something fixed.
Yeah.
And you mentioned it earlier in our discussions off camera about what did you call it?
The trans broken arm.
Trans broken arm. Do you want to explain a little bit about what that is?
It's a concept that we float around to say, that the trans broken arm is like everything you present with links back to your transness, no matter what it is, even if it's a broken arm, which is obviously a really silly concept, but that just proves the point. It's like you come in, you've got to think, oh, you're trans, it must be it. Like,
and that's a profiling.
That's a bit of a profiling, correct. So this is, again, taking, I don't know if shortcut is the right word. It's being lazy in a sense and putting your own concerns about. I think what it shows is that you're putting your own ignorance in front. If you are a person who knows nothing about trans people or their treatment or their hormones, and you sort of go, here's a trans person, then suddenly your concern for yourself is like, I don't know enough about this. And then you kind of circumvent the thing they came in with. And that's, again, poor medicine.
So, on the topic of trans broken arm syndrome, I used to have really high blood pressure, and I believe it's more so an older version of trans feminine HRT caused high blood pressure. And even though my blood pressure was the same before and after starting, the doctor I was seeing, who in every other sense had been a relatively good doctor, as far as I could tell, all of a sudden is like, I see, you have high blood pressure. I'm going to have to ask you to stop hormones. It's like, I have records for before, and...
Yeah, there's I guess what we're experiencing is this hyper focus on this part of our identity. So if anyone else came in with any of these conditions, ailments, diseases, anything that somebody presents with, the healthcare professional will assess that as the need that they need to address. And they might look at risk factors and they might look at all these other the variables that would play into that treatment. But I guess what we've experienced and what we're hearing from other community members is that when we present to health services, the first thing practitioners look at is our transness. And we experience this not only in healthcare settings, but in all settings, I think.
Yeah.
People see that first, and then they go, oh, what else is behind that part of your identity? Like, I can't see anything there because all I can see is this transness. So, yeah.
Your rainbows are blinding.
That's right.
That's a really good, I like that phrasing, yeah.
I've had another experience where it was more of a social construct in medical provision, and I was playing baseball and I was up to bat and the ball had been pitched and it was pitched at me, and it wasn't intended. I didn't feel it was malicious at all. It's just what happens in sport. And I had turned to get out of the way of it, and the ball struck me on the L3 and L4 vertebrae directly, and I lost sensation from my waist down and I struggled to make it to first base. They come out and they obviously did some concussion tests. I'm not too sure what that's going to do considering I didn't get hit in the head, but got hit in the spine. And I was just struggling with sensations and getting strength and stuff. And realistically, the game should have stopped. They should have stopped the game and taken me to the hospital. Obviously, with trans people who've gone through HRT, we are susceptible, particularly male to female, we are susceptible to bone diseases and, not a strong structure anymore, from what, I've been told by...
It's still a big enough injury for anybody.
Well, it's still one of those vulnerable areas, isn't it? It's the spine. It was quite high up on the spine as well.
Giving you the sort of symptoms?
Yeah, so maybe it was a little bit of that trans broken left arm, you'll be right, or you're a man or something like that.
Just stop your hormones, you'll be fine.
Yeah, so obviously I was...
Oh my God, a cure-all.
Yeah, I was struggling to play for the next few minutes, and I ended up taking myself off and got my partner to take me up to the hospital and got the x-rays, and fortunately for me, there was no long-term damage and there was no break, which could have quite easily been a broken vertebrae or something like that. If I was a cisgender woman that was out there and I'd been struck with the ball, would have they stopped the game? Would have they taken that more seriously for that, urgency and that care? So I assessed the situation for everything that was going on. I lodged a complaint in appropriate organisations and stuff, and I actually assessed it as, I did not feel safe keep playing if I was going to get hit with the ball in that sort of manner, where the game should have been stopped and I should have been taken off. Because yes, I am a lot more vulnerable these days, and that could have been a lot worse than what it was. So, it's I suppose that perception of healthcare and how tough a person is and that sort of thing. So,
Aaron?
So this isn't me. This is a friend I had a long time ago, who is a trans femme, and was experiencing very severe, debilitating chronic pain. Couldn't sleep, couldn't walk, basically bedbound, and was being refused painkillers because the staff at the hospital she was going to said the trans people are more likely to be pill seekers, so we're not going to give you anything. Which I think is also pretty common as well because of, I guess, the historic association between not even just trans people, but queer people in general, and party life and being drug addicts and such.
Yeah, that's that profiling that I was talking about.
Yeah, that's that profiling, right? Obviously, in my experience, not true. But yeah, I've seen that be used to deny all sorts of things. I saw one person get denied an ADHD diagnosis because the psychiatrist thought that this person was going to go and sell the ADHD medication.
Wild.
And I think, it's definitely the battle that all LGBT people have, but trans people in particular, that battle with healthcare and it being seen as not only the thing that allows us to be who we are, but also our enemy in the process, because we have to fight, tooth and nail almost every time we walk into a healthcare provider, unless we are lucky enough to have a good GP and a good local hospital. Every time we have to go into healthcare setting, there's a battle that's to be had, and I think that's something that needs to be recognised by healthcare providers to realise that we are a vulnerable group, not because we are physically vulnerable, there are physical vulnerabilities there, but because we are scared of what we have to encounter in those settings. And I think that's something that healthcare providers need to recognise, that that little extra step can help make us comfortable, and at least just respecting us, step one, is the best option for that.
Yeah, finding healthcare services that are affirming for us is a really important thing, and I think Abby is going to just let us in on a little secret. It's not so much a secret, but a piece of information about where we can find some good services.
Yeah, so a big thing about finding doctors and healthcare services, and as much as that, a bunch of other services as well. But if you're approaching a service, particularly in healthcare, and going, hey, I have this problem, and the doctor is not informed about trans issues, and you're saying, hey, I'm trans, and then they're going, that could be the cause, that's a massive problem, right? So having the education is really important. And that's actually part of the reason about why I built trans.au.
So, Abby, do you want to just explain to the viewers that are listening what trans.au is?
Yeah, so trans.au is a national directory service for trans and gender diverse services. We're also a news aggregation site. So if there's news that affects trans folks anywhere in the country, it will appear on trans.au, generally from one of our, as a link to one of our media partners. So Star Observer, Q News, out in Perth particularly. We built the directory because it was very much a case of it shouldn't be who you know, but what you know. You shouldn't need to find somebody else who is already transitioned to find the services in your town or in your area. So when we went to build it, we take submissions from the community to say, hey, I can't find out about the services everywhere, but we want to put this in one central location as much as we can. And we have a form on our website that with a bunch of different categories, and we're not just taking doctors, because we do have TransHub, which is great, but it's just doctors. And when I originally started work on trans.au back 2 years ago, it was just New South Wales, which helpful, but if you've got folks in Brisbane or folks in Melbourne, where's the directory services for those people? So I tried to put it as much as I could and link in as many different services as I could and say, we're covering off like doctors, we're doing sexual health, we're doing mental health, we're doing psychiatry, we're doing places of worship because that's important for someone who's transitioning. Hairdressers, gyms and fitness, all kinds of different categories. Because we recognize that walking into a gendered space, like just to get a haircut, can be terrifying for the first time. So making sure that the place that you're going to is trans inclusive.
Such a beautiful resource.
So,
absolutely. There's been many experiences where, I've wished for something like that to reference, where you've got to build up
20 years ago.
Well, I mean, we talked earlier in the other episodes about how exhausting it is to mask, but this is absolutely another thing that is so exhausting for us is to, when we have to go into any kind of service, whether it's a health service, hairdresser, and we don't know whether they're going to be trans inclusive or not. And so we sort of go in there prepared and hope. And sometimes we're pleasantly surprised, and other times we're like, oh, again, misgendered or told to leave. That's happened as well.
Beauty services are a great example of this, particularly like electrolysis and hair removal services.
Yeah.
Like when you're getting preparation for trans surgery, particularly for bottom surgery, is the practitioner of the electrolysis or the laser hair removal, are they willing to treat male genitalia? And that can be a hard thing to find. Hell, just finding someone who can do electrolysis can be hard. Like, I'm a redhead, right? I had to find someone in Ballarat that could do electrolysis. There was one place in the entire city that could do electrolysis. They happened to be really trans inclusive. So that worked out really well.
But
I'm like,
they like money.
Money's a good driver. But even with money, like I know that myself and others in the community have been turned away from services with comments like, we don't treat people like you.
Or we don't treat men is a very common phrase to hear. And it's like, yeah, but I'm not a man. I'm a trans woman.
And the service that you deliver is exactly what I'm seeking. So, and whether it's on your genitalia or even on your face, there have been people who have just been turned away.
I've had a very positive experience with that, though, here locally. I do utilise a couple of services here for laser therapy and stuff like that. And the women and the girls, the staff in general, have always been amazing. They're inclusive. They've been respectful. They don't have to roll out the rainbow carpet or anything like that. They just go in there, do what we need to do, and, I'm appreciative of the service, and they're lovely to talk to. So there are services out there like that. So,
and there's also people who are willing to learn. So they might not already be at that stage. When I was preparing for surgery and I needed to find somebody for electrolysis because it was around COVID and the window had closed and I couldn't get laser, so I had to go with electrolysis because it was a short window. Anyway, I rang around and I kept ringing and they kept saying no. And here in Bendigo, I did find somebody who said, they didn't say no, but they said, we haven't done that before.
Can't be my
Let me talk to our electrolysis and I'll get back to you. They did. And then the electrolysis had a meeting with me. And so they wanted to know like what the process was going to be like, for them, because it's a different
So you
type
pioneered
of
the way.
service. Yeah, but the point is that they learnt and they learnt on
were
me. I was a
willing.
bit of a guinea pig,
Yeah.
which was okay. And
They were willing and they learned and got the job done.
yeah,
Good.
So the thing there is about just you might not have done it before, but if somebody's seeking a service that you know that you can deliver, just expand a little and just be open to this.
They might not have been
opportunity.
presented with it either. So like it's a very positive response from
I
the
didn't
business.
know how to do testosterone injections. Learn.
Yeah,
Good.
Funny that how you can be taught, eh?
I had
and estrogen injections too now.
I can do estrogen implants. See?
Yeah,
Taught.
implants.
I
yep.
had to get my GP for gender affirming care. I had to go, well, how do I get you learning on how to do estrogen implants? I actually had to go and find someone to teach my GP.
Oh my gosh. Yes.
It was just
But then you change, like you then create a service that they can now do that for other people in your community.
Yeah, absolutely.
exactly.
And I think that's the important, multiple different points were made in those last few points. The fact that, gender affirming care and also just medical care outside of the gender affirming aspect doesn't always have to be like the rainbow carpet rolled out and everything, bells and whistles. It can just sometimes be going in and getting a script. And it can just sometimes be educating yourself, hopefully without having to ask the patient, so that when you're in the appointment, everything runs smoothly. And I think, that's a really important thing for healthcare providers to understand, is that going above and beyond is great, but it's also not really expected by us. You just have to know a few more things, and you've already kicked well past what a lot of doctors and a lot of healthcare providers and a lot of general service providers are already doing.
Yeah, the bar's pretty low already.
Yeah, the bars.
We're just
the
getting you to
bar's
come up where
super
everyone
low,
else is.
guys. So all you have to do is just accept us, respect us, and treat us how we want to be treated, and you've already come up a great step. And I think that's the most important thing for healthcare providers, who I'm sure there are probably plenty of doctors and plenty of nurses and other healthcare providers that probably worry themselves and go, I don't even want to delve into it because I know I'm going to do something wrong. And that's the case of the fear of the unknown, but at the same time, it's just a matter of being a good person, and that's the most important part.
Yeah.
Aaron.
I remember one time I had a HRT refill denied because the doctor was worried about being sued.
Being sued.
So there was a story going around about at the time a detransitioner who had tried and failed to sue their doctor.
Yeah, I have actually heard of similar stories of doctors that, because they didn't have the appropriate insurance, they couldn't treat trans folks. And that was actually a big story a couple of years back, wasn't
Is this a myth or is this a real thing? Do you need to have insurance to treat trans people?
So the answer, as with everything in medicine, the answer is it depends. And it depends what you mean by treating. It depends what you mean. And the insurance companies, there are, 3 or 4 big ones. Some of them will say, we cover you to do IUDs without any extra steps, for example. Some of them say you can do vasectomies. Okay, most of them don't. If you want to go and do vasectomies, it's a slightly different category, for example, like different procedures, right? So there are different levels of cover. I don't know for sure that any of them are particularly picky about HRT as such, because
I
that's a
thought
fairly...
one of the big ones
One of them
restricted
might
it
be.
recently, like a couple of years back.
I'm with this one, and they've not changed their policy as far as I know, but one of the others might have.
Okay.
Right? And I think that is the problem.
Because I saw some doctors actually changed their insurance
Because of
because
Yeah.
their insurance provider basically said, "Hey, we won't accept people with HRT."
Wow,
that was a
new to me.
That was a policy. It was covered in the ABC a couple of years ago. I'll see if I can find an article for you later.
And these things come up every so often. I think recently there has been a comment on our doctor Facebook page about one of the insurance companies saying they won't cover you for using any medications off label, which is like half of what we do. So that is very strange. So, we're busy having chats about that. So sometimes the insurers turn up with funny ideas.
Yeah, whether it actually goes through at the end of the day, we don't know. But
I will say, in this specific situation, he did tell me it wasn't an insurance thing or anything. It was his opinion that he didn't want to do it.
He didn't want to get sued. Yeah.
Which, again, the case he was referring to at the time was unsuccessful because you can't, as far as I'm aware, sue someone for that.
That's
Because of the paperwork you fill out when you're doing
It's called consent.
Yeah.
when you fill the informed consent paperwork, that's you signing away your ability to sue them, isn't it?
Basically.
Yeah.
Yeah, I've certainly heard from community members that have been turned away just because the GP doesn't agree that we should have access to
I've
hormones.
actually never met anyone who has detransitioned.
No.
So,
Yeah.
It's extremely
like
rare.
I've never met anyone who's hated the results of the therapy and anything like that. So it's
I've
such a
actually
strange and
I actually
alien-
know somebody who identified as trans for 2 years and then went, you know what? This doesn't feel right either. The masculine side of things didn't feel right for them. So they explored transitioning to female. That didn't feel right for them. So they just they haven't detransitioned. They've just
Gone in the middle
found where they fit.
So they're non-binary.
Well, they don't identify as non-binary. They just identify as a person, not masculine, not feminine.
That's fine.
They're just a person.
I'm a human.
Yeah.
Yeah. But that exploration allowed them
Yeah,
to sit into that space.
Yeah, but I still don't think that still meets the criteria of detransitioning, though. Like, someone who's gone, born one, transitioned, and then regretted it, and then detransitioned from it. So,
I think it depends how that person defines it themselves. To them, it could have been detransitioning.
Yeah.
But
Even
I
if it
think
doesn't fit
it's-
our definition
I
of
do
it.
kind of take your point that the, wrong side of politics has kind of used that as a bigger thing than it really is.
yeah, and I suppose it goes back to this whole, the debates or what we're talking about in these other podcasts. Are they bigger than what they actually really are? So when I went through the ringer with my healthcare provider, because obviously, I went before I could simply just identify. I had to go through all the psychological tests, and there is some very inappropriate questioning. In that, particularly when you're there, talking about gender, and they're sitting there just asking a whole heap of questions about sex, and it's like,
Yes.
it's like
Different things.
you're talking about sexual desire there. It's like I don't care about that, but they've got all
Isn't
this
a part of
stuff.
it that you have to be identifying as like attracted to the opposite gender to you still?
Well, that was
regardless?
questions that they used to use as like a test to find out if you were actually trans or not.
Yeah.
A lot of the questions were also revolved around were you adequate enough to have sex, and it's like, well, it's like, do you know that there's a lot more to
And if you're not
gender,
having sex, then
something's wrong with
That-
you.
yeah,
I
that's
had
right.
depression, so I was they tried diagnosing me with depression because I didn't like sex, and it's like, oh, you want to sit there and probe me and make all these uncomfortable questions. It's like, oh, you're looking a bit anxious about that. You've got anxiety disorder now. It's like, no, stop asking the questions. It's like,
and this has nothing to do with why I came in here.
yeah, right. So
So I'd like to think we moved a little
yeah,
beyond
off on a
that,
tangent.
You know what I mean?
Off-
Yes.
off on a tangent.
But it
Sorry
wasn't
about
so long ago, though. Like, these questions were being asked. I think in some places they are still being asked in Australia still. But rarely, given a lot rarer than it was. But I know of one person in Adelaide, I think was kind of was the person to see and did ask a lot of those questions. And everyone was like, "Oh, here's the script. Here's what you say," and that's how they got their diagnosis.
Well, hopefully they are old and won't be around for much longer. But
Oh, I think there's quite a variety now since then, because this was years ago. Like,
Like I've found a really good GP here locally in Bendigo. You know, I'm looked after by a wonderful endocrinologist. Don't exactly want to name her on radio, on air. You know, there is a lot more services. Obviously, what Abby's doing is really important moving forward. More businesses and more services we get, you know, displaying Zoe Bell stuff and the rainbow stuff. It is just, but we need to keep pushing that way.
But also, I think that society, culture, and organisations need to be looking past gender as the main point of identity to people's well-being and health, because you know that seems to be the big focus of how people are being assessed, and why our transness is the first thing that people notice, because when people come into the service, you know, they're assessing or they're marking on their box which gender, and if you're not in those two genders, then you know we need to focus on this, and I think that we need to just be looking past this thing of gender and going, well, what health needs do you need right now? And which is what, you know, what we're coming back to around this topic of there's so much more to us than our transness. You know, we're humans, we're cricketers, we're parents, we're
Advocates.
we're living the same lives as every other person,
Paying our taxes.
but we're also trans. Yeah. We'll jump to Abby first and then Aaron.
There was a really good comment there actually about like gender is it's so much less about what we are. It's really interesting actually, because when we go to see a doctor for a diagnosis, particularly around mental health, so I'm thinking like neurodiversity, autism in particular, right? Because the way that autism has historically been diagnosed is quite interesting in that allegedly what I had heard was that when they wrote the DSM and put autism into it, there was the people who wrote it said that there are two diagnostic criteria, one for men, one for women. And we want to put in both. And allegedly this story came back with you can only put one in. So they put in the male criteria, and that's why you saw a lot more men being diagnosed with autism. I don't know necessarily whether it's correct. However, like, as someone who is trans, I don't think that I met the male criteria. Now, I had a chat with the pediatrician at the time, because this was well before I transitioned, who diagnosed me with autism, but I never got the piece of paper to go with it. But I'm pretty sure, like, it was just a case of like, oh, you meet the criteria, but it's just like, okay. And I just never felt the same. Like I met the same criteria, particularly when I looked it up, and I'm like, oh, there's a separate criteria that's just not published properly.
I feel like as a broad trans experience, especially accessing healthcare, and this bleeds into neurodiversity as well, is it is such a spectrum, and we're such a diverse community and have such diverse experiences. That's where it becomes tricky from a health perspective, where it's very regimented, symptoms, guidelines, boxes. If you have a patient in front of you that doesn't quite fit into one or the other, then where do you go?
Yeah, goddamn society and its boxes.
Yeah.
I mean, my understanding is that a lot of we're talking about DSM-5 specifically, right?
It started earlier than that, but yes.
Yeah. A lot of that exists for insurance purposes, right? Like it has like these, you diagnose these things so you can treat it and get that covered by insurance a lot of the time, right?
It's less so in Australia, but overseas maybe.
I think gender dysphoria is a similar sort of thing where like it is diagnosed as a mental illness,
No,
but
not
it's
anymore.
really more so. Is it not?
Nope.
It got taken out.
Gender
Oh,
dysphoria
that's
was
great. I
removed
didn't know
from the
about that.
DSM. I didn't. Because when I was going through it, like growing up, being the age bracket that I it was treated as a disorder.
Oh, I didn't know that. I'm sorry.
The world. Why are you saying sorry to me? I didn't write the book. The world has changed, and we see these changes in all areas of life, and not just exclusive to that. The LGBTQI. But we see this in just cisgendered women's rights and everything. In the way that women are perceived with their mental health over time, and we've seen like stereotypes. Yeah, it was a criminal offence back in 1981 in Victoria for you to be a homosexual. So things change, and this is what life's about. Everything changes in society, and so much has changed. So yes. It used to be considered a disorder. It is no longer considered a disorder. It's actually now a protected attribute under the Equal Opportunity Act. So,
well, talking about social changes, that's, I guess, my big curiosity, especially for the health practitioners who are listening now, is what would it look like for healthcare to be more affirming and safe and accessible for trans people? To be able to go to a hospital and go, "Hi, I'm trans, I have a broken arm," and have the broken arm taken at face value.
Yeah, but I probably wouldn't you're sort of leading there with, "Oh, hi, I'm trans." Why don't you go, "Oh, hi, I'm Brody, I've got a broken arm. Can you have a look?"
Yeah, but that's the point. But the point of looking past the transness, and even if you did say that you were trans, that they were like, "Yeah, that's cool. Let's look at that broken arm."
Exactly.
Yeah.
It would be nice. And I think doing that with my own practice was kind of the goal, because I got really tired and sad for my patients who were kind of like, "Oh yes, I have a gender doctor here, I have a normal doctor here, I have a psych doctor here." I'm like, good Lord, you have lots of places to go and not enough time, right?
The whole medical team.
And you kind of don't want to do that. I feel like I also am very nosy, so I just like to know stuff. So I'm like, you come and you sit down and you tell me all your business and we'll sort it out, okay? And rather than part and parceling you, which is why I do general practice, very nosy. So I think it would be nice if we all had that kind of overarching ability to go, yeah, you've got all these things, that's fine. Which ones are the relevant bits today? And then which ones we actually have to parcel you off for, that's fine. Sometimes you do need to do that, but not... Ideally, I'd like it if we could all do that and do that routinely and not, turn a hair as such when people come in and have extra things that we didn't necessarily expect.
Yeah, I think for me to answer that question, it's about knowing that I'm getting holistic care. So, until I found this great GP that I see now, I couldn't trust that when I was going in and talking about a particular concern for me, that they were actually hearing that and not thinking about, but how am I going to treat this trans person? So I didn't feel confident in the support that I was getting. So to answer that question, it is absolutely to be able to go to a healthcare service and know that I'm going to be treated for all of my experience as a human rather than pigeonholed into what trans needs do I need. Yeah. Aaron?
No, sorry.
Yeah.
I feel as well, another big one, which I love when health practitioners do, they don't always, is this idea of being able to say, "I don't know, let me find out."
Yeah.
Because I feel health practitioners, perhaps generalizing a bit here, but if you have a patient presents as transgender and you have not interacted with that before, you extrapolate to what you do know to cobble together something to help them, which could be things that you've picked up from what you've seen on TV, things that you've read in a book, old dusty medical journal that you read in your first year of medicine. So having a GP be able to say, "I don't know, but let's find out," is fantastic. Like accessing my GP, going to her and saying, "I'm trans-masc. What's a good birth control option for someone on testosterone?" Having a GP be able to say, "I will find out," is all the better than just going, "That one, try that."
Or "I don't treat you."
Yeah.
Yeah. Abby, did you want to add?
Just from that perspective too of like, I would rather a doctor go, "I don't know, let me find out," than give you a dosage and then find out that dosage is woefully inadequate.
Yes.
Like, this is actually the story of what happened when I saw my endo for the first time. Now, I'm 6'2", I'm quite tall. And when I started hormones, I was 62.5 kilo. Now, that's quite light and quite underweight. But I saw the endo for the first time, and the standard starting dose wasn't 1 milligram of estrogen, it was 2. But I got started on 1. When I asked to be put on the testosterone blocker, cyproterone acetate, I had to do my own research about what my own medications should be. I had to go look up the Endocrine Society's documentation on and WPATH's recommendations for what's the recommended dosage for this? Oh, about 10 milligrams a day. What did my doctor put me on? 50 a day? And just seeing the eyes widen from the doctor here, and it was just like I had to go and find out that was actually very, very bad, and actually go back to my doctor and go, did you even bother to look it up?
Yeah.
No.
It's well-intentioned but not educated.
Yeah, exactly. And it was just, that's the smallest tablet that he could provide, because that's what he could find on the PBS or whatever. That's what he knew about. Whereas everyone else that I'd spoken to was like, oh yeah, I'm cutting that tablet into quarters. And I'm like, oh, so why didn't he know that?
EJ?
And I think that's the biggest thing is, and I can imagine a lot of health experts and experts in general don't like that feeling of sitting in the unknown, and don't like admitting that they don't know something. And I think it's healthy to absolutely say, I don't know, then mess it up. I'm, basically just echoing what you said. Yeah. It's something that I'd much prefer to work with my doctor. And I've had times where, outside of my trans experience, I've had 3 doctors sitting in the room staring at me, not quite sure what to do. And I didn't mind, because I would much prefer 3 doctors sitting in there arguing with each other over what they think I might have than one doctor being lost and guessing. And I think, if you're not sure as one person, you've got a whole healthcare team. That's the whole point of why we work in practices, why we work in hospitals, why we have Facebook groups and everything. Talk to people, talk to other people, because they might know. You might know someone who has worked with a trans person, and all of a sudden your world is broadened by that. And it's okay to say, I don't know.
And just guessing can be dangerous at times, especially when they're prescribing.
Yeah. You don't guess with that. This is why you have children who tell you you're wrong constantly, so you are humbled. And then you are able to remember that despite all the degrees on the wall, you also do not know everything. And especially as a GP, it is perfectly fine to sit back and realize I can't know everything. And that's fine, because even if I don't know the answer, I can A, look it up. I can B, I know where to direct you. And I can always tell you that and be quite honest. And I'm very talkative when I'm in consult. Imagine that, because I'm like, that problem, this, you know what? This guideline will tell me, let's do the thing. I am not Googling. This is the actual research thingy.
Dr. Google.
Yeah, and then I can show people my screen and go, this is the WPATH guideline, and I am not pulling these numbers out of nowhere. This is the Royal Children's Guideline. This is where I'm getting this from. And based on this, we're going to do this. And then if it doesn't work, there's the next step. So we don't guess. That is someone trying to cover their ass.
Yeah, you work with the patient, though, and this goes back to what we've been we've spoken about so much in a lot of the podcasts, is that talk to the person, get the information from the person, work with what you've given. Don't guess, don't assume. So,
but you shouldn't be also having to be as a trans person having to look up what the recommended dosages are, because the doctor's not willing to do their own research. That's not helpful.
You need a doctor that you can kind of go, hang on, just checking, is this the right dose? And then they don't take offense at that. That sort of relationship is nice, and then you can actually have a human conversation rather than them lording it over you and going, you just take this thing,
I'm a proud trans woman. I offend a lot of people.
No, really?
Beautiful.
Yeah, one of my first experiences, seeing a doctor after I moved out of home. I I forget what it involved exactly, but I think I said I want to start antidepressants or something, and I was like, hey, I'd like to start antidepressants, and I'd maybe like to try this particular one, because antidepressants is a lot of cycling through different ones that may or may not work. And he said, this isn't how this works. I tell you what you need.
Shit.
You do not come in here and tell me what you need.
No.
Yeah, that sounds good.
And it was just like, is that how what seeing a doctor is like? And it turned out no, because every doctor after that was like, yeah, you come in here with a problem.
Yes.
And if you ever a way you want to go with it, then that's like usually a good thing.
We might come to Atomic, and then we might need to wrap it up.
I think one of the things that we could probably, help the service providers, regardless of who they are, GPs, health and beauty, which is funny enough, gender affirming care, and all those other services is, I suppose, reflect if a person's gender is actually relevant to the service that you provide. Work out if the person's gender and their identity is relevant to what that person has come to your business for. And if it's not, why make it a thing? Just be respectful to the person, regardless of their gender. All right? Get their business, treat them well as a customer, and they'll come back.
Yeah.
Yes.
Absolutely.
Well, thank you, everybody, for participating in episode 6 of our podcast. And I'd also just like to thank again the Victoria's Pride, the partnership between the Victorian Government and Midsummer, for the wonderful support for us, allowing us to put on this podcast. And thank you all for listening. I hope you got through all the episodes and are here at episode number 6, and that you've learnt a lot along the way, and you have a broader understanding of what the trans experience is. So thank you so much for listening, and we look forward to seeing you in season 3. Oxbridge, I just do what I do.